So if you're preparing for the MSRA clinical paper, have a look at this example question. Okay, so hopefully you've written down your answers for each one. I'm going to launch the poll for one at a time now. While you select what you've already decided, I'll just remind you of the question. So key things in this question is that this patient is 55 years old and they've got stage 1 hypertension, but with risk enough that they need drug treatment, because not everyone with stage 1 needs drugs. Okay, this is important. They're not on any medication and they're otherwise well. They don't have any other diseases or illnesses that might change what's a suitable treatment for them. And then the ethnicity is white British. So what's the most suitable? So we've got a split here. Just over half of you have picked C, calcium channel blocker, and just under half, 40-something% of you, have picked A, angiotensin converting enzyme, ACE inhibitor. Okay, the correct answer is C, calcium channel blocker. Why is that? Because if we look at the guideline, this is from the NICE guideline on hypertension management, the current one. In terms of someone who needs medication, the first step when you're starting them on one drug, to decide what they go on, you need to look at 3 questions. Number 1, are they diabetic? If they're diabetic, then you're going to start them on this side of the algorithm, an A-class drug. Okay. Second question, are they of Afro-Caribbean family heritage? Okay, because if they're diabetic, remember it's an A-class drug. If they're not diabetic and they're Afro-Caribbean, then regardless of age, it's a calcium channel blocker. If they are not diabetic and they're not Afro-Caribbean, now you care about age. Under 55, it would be an A-class drug. So A-class drug is ACE inhibitor or ARB. And if they're 55 or more, and this patient was 55, then it's C, a calcium channel blocker. That's why this patient, can we see, would be started on a calcium channel blocker, because they're 55. They're not diabetic. They're not Afro-Caribbean. Okay, so calcium channel blocker is the first line drug for this patient. Okay, second one in the set. So remember, you've already decided your answer. You're just entering what you already decided. So the key thing here, this patient is Nigerian and they've got diabetes. Okay, the age is 60. That's not relevant for this particular question, but in some questions, age might be relevant, like the one before. But because they're of Afro-Caribbean heritage and they've got diabetes, this is one of the special circumstances. So big split this time. Most popular answer, most of you picked ACE inhibitor, and then about a fifth picked ARB, a fifth pick calcium channel blocker. Correct answer is ARB. And that's because this is one of the special circumstances. If someone is both diabetic and Afro-Caribbean, because in the guideline, whenever a patient who's Afro-Caribbean needs an A-class drug, the first line is ARB, not ACE inhibitor. Whereas if they were not Afro-Caribbean, ACE inhibitor would be first line, and you'd use an ARB if there was a reason that they couldn't have it or if they didn't tolerate it. Type into the chat, what's a really common side effect that leads patients who start an ACE inhibitor to stop after a few weeks? What's one of the most common ones we always warn patients about? A dry cough. Yeah, absolutely. Okay. But you see, because this patient's Afro-Caribbean and they're diabetic, then they need an A-class drug, but that A-class drug is an ARB, first line. Okay. It's one of the special circumstances. That's why it's worth knowing. That's why we're covering it. Okay. Last one in the set. Now, can you see this particular question? There are 8 options. In the MSRA, extended matching questions can sometimes have 9, 10, even 11 answer options for you to pick from. Okay. So key things here is that this patient is 41 and they're having an antenatal appointment, i.e. they're pregnant. No other medical history, not on any medication. So the most popular answer, about 60% of you picked a beta blocker, and then it's a spread between ACE inhibitor, calcium channel blocker, and alpha blocker, right? The correct answer is beta blocker. Type into the chat, just for additional learning, which one specifically would be considered first line for this patient who's pregnant. And I'm going to look at something really important in technique after that. Okay, so I look at the chat. Well done. Most of you have got it correct. The first line for someone who's pregnant, if you're starting treatment or if you're changing from something else, is labetalol. Okay, it's a beta blocker specifically recommended for treating hypertension in pregnancy. Now, if labetalol is not suitable, nifedipine, which is a calcium channel blocker, but a specific one, is suitable. But can you see it's an unlicensed use. So this is why, if we go back to the question, bit of technique here, most suitable medication means most suitable for this patient in this scenario. It doesn't mean none of the others would work or none of the others can be prescribed. It means it's a relative term, right? What's the best one for you to actually give this patient in this situation? So it's a general principle of prescribing that if you have a treatment like labetalol, which is E, which is licensed for this condition, and you have one which can be used, but it's unlicensed, sometimes called off-book prescribing, like nifedipine, which is a calcium channel blocker, then the more suitable one is the one that's licensed because you've got more trial data on it. That's why E is the correct answer. You can see it because it asks most. If this question was a multiple best answer and it said, which 2 classes of medication could you prescribe for this patient, then the answer would be C and E, because you could give nifedipine. There's also another one, and that is methyl-dopa. If labetalol and nifedipine are not suitable, then methyl-dopa, which is a centrally acting antihypertensive, can be used for hypertension in pregnancy. Okay. What's really important is that A-class drugs, ACE inhibitors, ARBs, are not safe in pregnancy. So if someone was already on an ACE inhibitor and well controlled, then they became pregnant, you'd change them to labetalol. Similarly, thiazide-like diuretics not recommended in pregnancy as safe. All right, so you change them. Okay, so do you see, this one's licensed, nifedipine's unlicensed, so this is the better option. That's why E is the right answer and not C. Okay, so if you found that helpful, this clip was taken from our MSRA Masterclass webinar. You can watch the 75+ minute recording to cover lots of questions and boost your preparation. I'll pop the link down below.